In terms of open disclosure and developing an open disclosure policy and implementing an open disclosure policy in the pharmacy, it should be recognized that there is the potential for significant resistance to such a policy. And in that regard, the fear of actually being blamed, the fear of losing one's position or job, and the fear of loss of professional reputation and career prospects in relation to what has happened or what has occurred are very real fears that can exist for people within the organization and can mitigate against a full implementation of an open disclosure policy, even in the context where open disclosure is the required approach within the healthcare organization. Alongside these fears, there can also be a fear of litigation. And certainly in Ireland, there isn't legislation which protects people who have admitted in open disclosure or no blame culture. So to that extent, the legislative protection in Ireland could certainly be stronger in this regard, and that gives rise to further concerns in relation to open disclosure. So it is true to say that there are real barriers to the implementation of an open disclosure policy in healthcare organisations. However, and the Commission on Patient Safety in 2009 recognised the reality of these concerns amongst healthcare professionals. That said, the benefits both to the service user and to the service providers are also present, and on balance it is recommended and certainly is the default position within the healthcare services now that an open disclosure policy should be in place and should be implemented in healthcare organizations. In terms of implementing such a policy, one needs to be mindful of these barriers and these fears that do exist, and to work through these fears amongst service providers and within organizations so as that the open disclosure policy can become a reality.